Okay, welcome back. In this video, we will cover chapter number 14 in our anatomy series, the lymphatic and immune systems, your defense systems. Now, your immune and lymphatic systems work to protect your body against pathogens that can cause disease. So without either one of these systems, you will not live for too long. Some learning objectives for this chapter: be able to list and describe the major components of the lymphatic and immune system and their functions. Explain the antibody-antigen relationship. Name and describe the functions of the blood cells responsible for protecting the body from invasion. Discuss how inflammatory responses and fevers relate to infection. Compare the innate immunity to adaptive immunity. Describe the function of B and T cells in the immune response. And lastly, be able to list and describe several common diseases of the immune system. Alright, first we'll start off with the defense zone. See, if a group of pathogens tries to enter the body, they must first get past several barriers, such as your skin and the secretions of the mucous membranes. If a pathogen does get into the body, it is recognized as not being a part of you. It's being recognized as being foreign or not belonging to you. Various weapons in the form of specialized cells are engaged by the lymphatic systems and the immune system to fend off such pathogens. These weapons include not only specialized cells, but powerful chemicals of the immune and lymphatic system. Now, these chemicals can stimulate the inflammatory response and also the cleanup response. So this is a combined and integrated effort of the immune and the lymphatic systems. Alright, we'll start with the lymphatic system. Okay, the system works very closely with the cardiovascular system, and it functions as both the transport system and as the barracks of the immune system. There are four functions: recycling fluids that are lost from the cardiovascular system, transporting pathogens to lymph nodes where they can be destroyed, the storage and maturation of some types of white blood cells, and the absorption of glycerol and fatty acids from foods. The smallest pipes of the lymphatic system are called lymph capillaries, and they will run parallel to the blood capillaries. Now, lymph capillaries form a network between the cells of connective tissues, but unlike blood capillaries, are open-ended. Proteins and fluids are lost from cardiovascular capillaries as they are squeezed out due to osmotic pressure, and they go into the interstitial space. So from there, they will enter the lymph capillaries. Once that fluid enters the lymph capillaries, they're now called the lymphatic fluid, or lymph for short. Now, lymph is a straw-colored clear fluid, and its primary component is water. Lymph capillaries will empty into lymphatic vessels. These are going to be very similar to veins, but even thinner. Many of them will have valves to prevent backflow of lymph. In addition to these valves, body movements through the skeletal muscle and smooth muscle help propel lymph throughout the lymphatic system. Here's an illustration of the relationship between the blood capillaries and the lymphatic capillaries. In this image, the lymphatic capillaries are the ones in green, and they form a network running along right next to the blood capillaries. Some examples of some lymphatic organs, such as the tonsils, the lymph nodes. All these little green circles are lymph nodes. Here, here, here. Now, the large vessels of the lymphatic system enter into lymph nodes. These can range anywhere in size from as small as a pinhead to about the size of an olive. Now, lymph nodes are filters that are all throughout the pathways of these lymphatic vessels, throughout the lymphatic system. These will be small encapsulated bodies that are divided into smaller sections. Now, these sections are made up of white blood cells called lymphocytes. Now, the lymphatic tissue surrounded by the lymphatic sinuses are filled with lymph fluid, and their goal is to filter and destroy pathogens using these lymphocytes, using these specialized white blood cells. Now, lymph nodes will be concentrated in the cervical region, just near your neck, axillary, which is in your armpits, inguinal, which is your groin area, pelvic, abdominal, thoracic, and supratrochlear areas. The adenoids and tonsils are also part of the lymphatic system. Now, here's an illustration of a lymph node and a structure. You have lymph fluid going into the structure here. Then you see the various sections that make up the lymph node. And here you'll find white blood cells that help to filter and destroy pathogens. And then the fluid will exit out the node here. Lymphatic vessels that exit a lymph node will exit into what are called lymphatic trunks. And these trunks are named for the area that they serve. These are basically points to drop off drained lymphatic fluid. And some of these regions include intercostals, lumbar, subclavian, jugular, intestinal. These lymphatic trunks will then empty into one of two collecting ducts. There are only two collecting ducts throughout the body. See, the lumbar, intestinal, and intercostal trunks will empty into the thoracic duct, which is the larger of the two collecting ducts. Roughly 2/3 of the lymphatic system will empty into this particular duct, the left lymphatic duct, or the thoracic duct. The bronchomediastinal, subclavian, and the jugular trunks will empty into the right lymphatic duct. So this duct only drains lymph from the right side of the face, the right side of the chest, and the part of the right arm. Everything else in your body drains into the thoracic duct. Now, lymphatic fluid flows only in one direction, from the body tissues and organs back to the heart. So the circulation of lymphatic fluid will go from, say, blood to tissues, tissues to the lymphatic capillaries to lymphatic vessels onto lymph nodes, from lymph nodes into lymphatic vessels into lymphatic trunks, and after lymphatic trunks into one of the two collecting ducts, the right collecting duct or the thoracic duct. And the collecting ducts will deposit their filtered lymphatic fluid into the subclavian veins, and then back into the cardiovascular system. I now move on to a pathology connection. Tonsillitis is an inflammation of the tonsils, usually caused by bacterial or a viral infection. Some common symptoms: sore throat, difficulty swallowing, swollen tonsils, and fever. They also have upper respiratory symptoms, a visible coating or visible spots on the tonsils, having upset stomach, having swollen lymph nodes right around the tonsils. A diagnosis: physical exam, noting the inflamed tonsils. Bacterial tonsillitis can be diagnosed or ruled out due to a throat culture. This will also check for the presence of strep throat. Viral tonsillitis, like all viral infections, won't respond to antibiotics and will go away by itself. For treatments, whether it be viral or bacterial, symptoms can be managed with rest. Make sure that you are hydrated with the fluids. Tylenol, for example, could also include a tonsillectomy, which was used pretty regularly in the past, but it's only used today if tonsillitis is a chronic condition or the tonsils become so enlarged they risk obstructing your airways. I'll now move into some lymphatic organs. First one we'll talk about, the spleen. This is a spongy sac-like mass of lymphatic tissue in the upper left quadrant of the abdomen. Now, structurally, it's very similar to a lymph node. It really is just a really big lymph node, but the only difference is for a lymph node, the lymphatic sinuses are filled with lymph, but the spleen, its sinuses are filled with blood. Surrounding the blood sinuses are islands of white pulp containing lymphocytes, and islands of red pulp containing both red blood cells and white blood cells. So two different kinds of tissues found within the spleen, red and white pulp. Now, the functions of the spleen: to remove and destroy old or damaged or fragile red blood cells, also to filter pathogens from the bloodstream and destroy them, just like a lymph node would. Now, the spleen is not considered to be a vital organ. This can be surgically removed and it not be that big a deal for the patient. Now, removal in children can severely compromise immunity, but this will have a lesser effect if it's removed in adults. Here's some examples of the last few lymphatic structures we talked about. The spleen right about here, the tonsils here in the back of the mouth. Here where the cursor is the right lymphatic duct, and the thoracic duct right about here. This will drain most of the body. The right thoracic duct only drains lymph from the right side of the face, right side of the neck, shoulder, most of the right arm. Another lymphatic organ, the thymus, is the soft organ that's found between the aortic arch and the sternum. It starts off very large in children because it's needed to fight off new infections. But after you hit puberty, it will start to get smaller and smaller and smaller, and by the time you are middle-aged, it's basically almost completely gone and replaced by fat tissue. Now, as it continues to get smaller, it will continue to have the same activity in adults as the immune system matures, but it does get progressively less and less in size. And the thymus will produce lymphocytes that mature into a type of white blood cell called a T lymphocyte. And the thymus will also secrete a special hormone called thymosins that help to stimulate the maturation of these T lymphocytes. And as we talked about in a previous video, all blood cells originate from the bone marrow, from the skeletal system. But when we talk about T cells and B cells, where they mature is indicated by their name. T cells will migrate from the bone marrow to the thymus to mature. That's why they're called T cells. So T thymus and T4 T lymphocytes are T cells. And then the B cells stay in the bone marrow to mature. Now move on to another pathology connection, some lymphatic disorders. Lymphadenitis is where the lymph nodes will swell. This could be a very localized condition or a generalized condition, usually the result of a bacterial infection, but can also be caused by parasites or funguses or viruses. Some common symptoms: swelling of the lymph nodes, fevers, chills, excessive sweating, a rapid pulse, and a weakness. And for treatments, infection-specific medication. Mononucleosis, also known as the kissing disease. This is a viral infection. It can infect children and also young adults. It's caused by the Epstein-Barr virus. The virus is transmitted through oral contact, which is why it's called the kissing disease. Some common symptoms: sore throat, fatigue, fever, increased number of lymphocytes, lymphadenitis. And for treatments, there is no specific treatment to treat mono. Hodgkin's disease, or Hodgkin's lymphoma. This is a rare cancer that will affect the lymphatic system. Some early symptoms: swollen lymph nodes, unexplained fevers, night sweats, fatigue, weight loss, itchy skin. The cause of Hodgkin's lymphoma is unknown at this point. Some common treatments: chemotherapy, radiation, or a combination of both of those. All right, now move on to cancer stages and the lymphatic system. Now, cancer cells can spread throughout the body through the lymphatic system. So the degree of spreading can be used to predict a patient's prognosis. Cancers that have already spread at the time of diagnosis are much more likely to become fatal. So the earlier a patient is diagnosed with cancer, the better the chances are of beating the disease. Now, the stages of cancer are all based on the degree of how far it has spread. So the first one, stage 1, there's no spread from the site of origin. Stage 2 is spread to nearby tissues. Stage 3, it is spread to nearby lymph nodes. And for stage 4, spread to distant organs and tissues. This is often terminal. That's why there is no stage 5. Once you have stage 4, you're very close to the end of life. Right, now move on to the immune system. These will provide weapons and troops to protect the body from invasion. So it is comprised of a variety of cells and chemicals and barriers that protect the body from invasion by pathogens. A pathogen can't make you sick unless it's able to get inside your body. Now, some processes are very active, some processes are passive, some are ones you are born with, and some you develop through change over time. First, we'll talk about antigens. These are molecules on the outer surface of a cell that identify them as being friend or foe. So this is how your body recognizes what cells are from you and what cells are foreign. If something is determined to be foreign, it will be attacked by your immune system. Every living thing has a unique cell surface antigen. This is what allows your immune system to distinguish between you and things that are not you. So this ability is called self-recognition and non-self-recognition. And this is the heart of how your immune system works. If your immune system can't determine what is not you, then it can't attack pathogens. So a well-functioning immune system will ignore cells that are you, your own self-antigens, and will attack ones that are foreign. That's how it should work in a normal, well-functioning system. Alright, now we'll talk about antibodies. These are proteins that bind to antigens and eventually will destroy them or lead to their destruction. And these are one of the most potent weapons of your immune system. And these are called into action when a foreign antigen invades the body. So antibodies don't really destroy things on their own. They will disable antigens and help with them being eliminated, but they don't actually do the destruction themselves. Alright, now move on to different types of immunity. We'll talk about the innate versus adaptive immunity. Innate is your natural immunity, what you are born with. This is your first line of defense against invasion. This is not affected by environment. There's nothing you can do to affect this. It's what you are born with, and it's something that is permanent. Alright, your innate immunity will help to prevent invasion, or if the pathogens do get inside your body, it will take steps to stop the spread of the infection. Now, this type of immunity can only recognize something that is not native to you. It can't identify foreign invaders. It just sees what is you and what is not you. That's something that does not get better with experience or over time. It's what you're born with, so what you have when you're born is what you have. This can't be improved upon. So because it can't recognize specific pathogens, it can't remember. There's no memory of antigens it has fought before. So this type of immunity is faster, but also very non-specific. This type of immunity is really a collection of relatively crude mechanisms for defending the body against infection. Some other parts of the natural immunity are similar to weapons of mass destruction. They indiscriminately kill pathogens and healthy tissue alike. If there's anything that's even slightly foreign, they are all taken out all at once without trying to target specific things that are making you sick. Now, in comparison to that, the adaptive immunity or acquired immunity is a backup to your innate immunity, but this will specifically target invaders, and it will ignore healthy tissue as much as possible. So this type of immunity takes more time to develop, but much more specific and much more effective. Another good feature about the acquired immunity is that it keeps a record of pathogens it has fought in the past. So if it is exposed to them again, the response can be much faster and much more aggressive. That's why if you've had measles as a kid, if you are exposed to measles again later in life, you won't get sick with measles because your immune response is so much faster and so much more aggressive due to the memory cells in your acquired immune system. So even though these are different systems, the innate and adaptive systems are not two separate entities. They work hand in hand together. The innate immunity will prepare the way for the adaptive immunity, weakening some pathogens and stimulating components for your adaptive immunity. So even though they work separately with different functions, they still work together. And the adaptive immunity, in turn, will stimulate innate immunity, attacking pathogens on two fronts. All right, now move on to barriers. A barrier is anything that prevents an invader from getting inside your body. The first barriers are the physical barriers. These are your first line of defense. These will also be located in the areas that are most likely to be invaded, such as the mucous membranes of the eyes, digestive system, respiratory system, reproductive system. So not only are these surfaces difficult to penetrate, but they're also going to be packed with white blood cells and lymphatic capillaries that trap invaders, so they don't get any further into the body to get you sicker. Now there will be fluids that are associated with such physical barriers, such as saliva or tears or urine or mucus secretions or sweat, and all of those contain chemicals inside the fluids that also act as barriers. All right, now move on to various cells of the immune system. The first one, white blood cells or leukocytes. These are responsible for defending your body against invaders. Now red blood cells are responsible for carrying oxygen throughout the body. And then platelets are responsible for the body's ability to clot when injured. All right, leukocytes. These will form the bone marrow and will move to other parts of the body to grow and mature. Some will stay in the bone marrow, some will go to the thymus. These will not be released into the bloodstream unless an infection is present. Doing blood tests to check for white blood cell counts is a good indicator that an infection may be present. Many of these should only be released when needed if an infection is present. And there are various types of white blood cells that are required to protect your body in varying circumstances. All right, here are the major leukocytes: neutrophils, eosinophils, basophils. Those fall under the category of being granulocytes because their cytoplasm has these granules in them, look like bits of sand. So they look grainy, so they're called granulocytes. And then the monocytes and lymphocytes, these are agranulocytes. All right, this table has a good summary of the various cell types and their function, and whether or not they fall into the innate or the adaptive immunities. Neutrophils, these take care of the phagocytosis in the early on in the infection. The macrophages, these are monocytes that have left the blood to go into tissues. These take care of the phagocytosis later on in the infection. Basophils release inflammatory chemicals like heparin, like histamine. So that's why when you have allergies, that's why you take antihistamines to counteract that release by these cells. Eosinophils will fight parasitic infections. Natural killer cells, these are part of the innate immune system. These go around your body killing anything that is even slightly foreign. And the last two on here are the T cells or T lymphocytes, or B cells or B lymphocytes. Either term is fine. We'll talk about how they function here a little bit later. All right, now move on to another pathology connection. This one we'll talk about leukemia. Leukemia is a cancer of the bone marrow and the blood. That's characterized by an overproduction of white blood cells. Now, in some forms, these cells, even though they're higher in number, they will be very immature and non-functional. So you would think having a high number of white blood cells would be good, but there's so many of them, most of them don't work properly. So they are in the way of other cells. Now, there are various types of leukemias: acute myelogenous, chronic myelogenous, acute lymphocytic, and chronic lymphocytic. For the myelogenous leukemias, the blood stem cells divide completely out of control. So whenever you have cells dividing out of control, they're producing larger and larger numbers of non-functional cells, which end up producing tumors. Lymphocytic leukemia, the cells that divide out of control are the lymphocytes, either the B cells or the T cells. And again, when you get cells dividing out of control, you're producing large numbers of non-functional cells. The acute leukemias, acute always means a rapid onset of symptoms. So for here you have an overproduced white blood cells that are immature and non-functional. And for the chronic leukemias, symptoms develop slowly over time, and you're overproducing white blood cells, but they are mature and functional, but you still are producing much more than is necessary. See, the causes of leukemia are not known exactly. Now, some types of leukemia are more common in children, and there are some that are more common in adults. The chronic myelogenous leukemia is associated with the Philadelphia chromosome, which is a chromosomal abnormality. Patients with Down syndrome are at a higher risk for developing acute myelogenous leukemia. Or the symptoms of leukemia can be caused by a variety of things. They can be caused by a decreased function of immature white blood cells, if the cells are immature, or can be caused by a decreased number of red blood cells and platelets, because they are crowded out by the larger numbers of the white blood cells. Some other symptoms of leukemia: anemia, shortness of breath, fatigue, repeat infections, enlarged lymph nodes, weight loss, muscle aches, excessive bruising, and bleeding. Diagnosis: a complete blood count, CBC, bone marrow test, also genetic testing. Treatments: of course, this will vary depending on what kind that you have. Could involve chemotherapy, could involve antibody treatments, could involve stem cell or bone marrow transplants. For those that suffer from chronic lymphocytic leukemia, there is no cure for this condition. The only thing you can really do here is to manage the symptoms. For those who suffer from acute lymphocytic leukemia, this is very common in childhood leukemias. It usually has a very high rate of successful treatment. All right, now I'll move on to various chemicals found in the immune system. And these chemicals are used to assist in destroying and neutralizing invaders. The first one, cytokines. These are involved with both the innate immune system and the adaptive immunity. Cytokines are really proteins that are produced by damaged tissues and white blood cells that will stimulate the immune response in a variety of ways, including increasing inflammation, stimulating lymphocytes, and enhancing phagocytosis. Interferons, these are a cytokine that is produced by cells that have been infected by a virus. Now, these chemicals will bind to neighboring healthy cells to stimulate them to produce chemicals that will protect them from viruses. And there has been some success as using interferons as an anti-cancer drug, but still in an experimental stage. So basically what interferons do is they're produced by cells that are sick to warn cells that are healthy to protect themselves so they don't get sick. Now, many cytokines are types of molecules called interleukins. Now, there are at least 10 different interleukins involved in every aspect of the innate immune response and your adaptive immunity. These have been used with moderate success to treat some forms of cancers. The example of that would be TNF, tumor necrosis factor. This is another cytokine that will stimulate macrophages, and this causes cell death in cancer cells. Next thing we'll talk about is something called the complement cascade. Now, this series of reactions is pretty involved, pretty complicated, but the series of reactions will activate a series of plasma proteins that are normally inactive in blood unless they're activated by some invasion of a pathogen. So when these plasma proteins are finally turned on and activated, there's a variety of different effects. They can lead to the lysis of the bacterial cell, the lysis of the bacterial cell membranes. They can stimulate phagocytosis. They can increase the attraction of white blood cells to the site of infection. They can help clump together the cells with foreign antigens, because antigens are easier to gobble up and destroy when they're clumped together in one mass, as opposed to one over here, one over there, one over here. And this is found in both the innate immune system and the adaptive immune system. All right, next we'll move on to inflammation. It's also called the inflammatory response. So typical symptoms of inflammation: pain, heat, swelling, redness. Now, this is a deliberate action of the body in response to tissue damage, whether it be mechanical damage or a pathological injury. This response by your body does a few things. It helps to wall off the infected area so the infection doesn't spread, and also to target the site of the battle. It's easier to have a fight when it's isolated into one area as opposed to having to fight multiple battles all throughout the body. So when tissue is damaged, cells will send out various chemical signals, such as histamine, which is an inflammation modulator. These chemicals will attract white blood cells to the site of damage. It also will increase the permeability of capillaries. It will cause local vasodilation, which means extra fluid causes swelling, which means more blood will come to the site, which causes heat. These white blood cells will go to the site of injury. They will destroy pathogens and clean up any cellular debris and any dead cells when they're finished. Now, the increase in fluid and the cells coming to an area increases the pressure in that localized area, which creates pain. Now, inflammation is a part of your innate immune mechanism, but also has a role with your adaptive immunity as well. Alright, this figure has various causes and consequences of the inflammatory response. So you have the injury up here. It looks like he cut his finger on the speaker, and various factors of what happens next. And this covers everything from the release of histamines and prostaglandins, leukocytosis, the attraction of white blood cells, how you get heat, redness, how you get pain and swelling, all step by step what could possibly happen here. Alright, now we'll talk about a pathology connection involving inflammation. This has a positive feedback loop. Once it starts, it will continue until it is turned off. So too much inflammation, particularly in a closed space like the brain or the spinal cord or the respiratory system or the extremities, can be very serious and cause some serious damage. Now, widespread inflammation or systemic inflammation is called anaphylaxis. Now, this causes widespread vasodilation, and your blood pressure will drop. It will drop very dramatically. Now, this can become fatal if not treated immediately. Now, patients who are more prone to having anaphylaxis will carry or should carry an injectable epinephrine treatment. That's why it's called an EpiPen, because it looks like a pen that you would write with, has a dose of epinephrine inside it. And this is used to treat acute reactions. So those people that have very severe, say, peanut allergies or food allergies should be carrying an EpiPen with them at all times. Inflammation can be treated with several medications. Ibuprofen, nonsteroidal anti-inflammatory drugs, or NSAIDs, steroids, antihistamines, in particular for allergic reactions. Now move on to fever. During an infection, your immune system will release cytokines that promote inflammation and the immune response. One of these cytokine targets is the hypothalamus within the brain. And the hypothalamus is what is responsible for setting and maintaining your internal body temperature. So the effect is that cytokine affects your hypothalamus, which causes your elevated temperature set point, which leads to a fever. Now, the rise in body temperature is deliberate. It's an attempt to destroy pathogens by your immune system. Next, we'll talk about some more details of the innate immunity. First, pathogens must get past a variety of different chemical and physical barriers. Once they get inside your body, the presence of foreign antigens are detected by neutrophils, which they will ingest foreign antigens, and they will destroy it and then release the chemicals to attract other white blood cells to the site of infection, which will stimulate inflammation. The release of cytokines and the stimulation of the inflammation response attracts macrophages and cells called natural killer cells to the site of infection. These macrophages will phagocytize infected cells, and the natural killer cells will destroy infected cells with a chemical called perforin. Both of these cells will release chemicals that will further stimulate inflammation, which will further activate more immune cells, which will trigger the complement cascade. Now, the pathogens are under attack from phagocytosis, noxious chemicals, membrane ruptures, clumping, and even alteration to the molecular structure. So there are chemicals that have signaled your hypothalamus to raise your body temperature, and then you run a fever. So that's why a fever is a good indicator that you have an infection somewhere. The innate immunity you can consider to be crude warfare, because there are no specific attacks. When the innate system responds, it not only kills infected cells, but it also will kill healthy cells. So there's no specificity here. But also, the activities of the innate immune system will stimulate the adaptive immunity. When these phagocytic cells ingest these foreign pathogens, after they destroy the pathogens, what many of them will do is they display a piece of that antigen on its surface. At this point, they are called antigen-presenting cells. Now, this role is vital for the activation of B cells and T cells, which is what you'll find in the acquired immune system, which is what we'll talk about next. All right, now we'll go into more detail on the adaptive immunity. Now, a key feature about the adaptive immunity is that it fights very specific pathogens. It also has a memory. It keeps basically a database of pathogens it has fought in the past, and it learns from this past experience. someone's able to recognize things it's fought previously, the response will be much faster and much more aggressive. And it's because of this adaptive immunity, this is how immunizations are able to work. Now, the innate and adaptive immunity work hand in hand. One can't do the job without the other. So even though they work separately and in different ways, they still must work together. All right, now move on to lymphocyte selection. In order to function, lymphocytes must be able to recognize pathogens and ignore your normal, healthy, regular tissues. Now, lymphocytes must be selected through one of a few ways. First one, positive selection, is where you have T lymphocytes that recognize self-antigens are allowed to survive, but T lymphocytes that do not recognize self-antigens are neglected and then eventually will die. You can also have it selected through negative selection, as through destruction or deactivation of self-destroying lymphocytes. Now, both positive and negative selections must work in order for the immune system to function properly. So you must have lymphocytes that attack invaders but don't attack you. All right, now move on to another example of a pathology connection. We'll talk about some autoimmune disorders. And these occur when your immune system attacks some part of your body because your immune system fails to recognize your own tissues and sees it as something foreign. Now, most disorders are treated with immunosuppressant drugs, which may or may not be successful, and the side effects of these drugs can be severe. Now, there are hundreds of examples of autoimmune disorders, each affecting different body systems, and we'll talk about just a few. First one, rheumatoid arthritis. These attacks the joints and the physical linings of the joints. Multiple sclerosis. This attacks myelin coverings of neurons in the central nervous system. Lupus. This attacks almost every tissue, even perhaps DNA. Type 1 diabetes. This attacks the beta cells in the pancreas, and it prevents them from making insulin. Myasthenia gravis. This attacks acetylcholine receptors in the skeletal muscle. Graves' disease. This attacks the thyroid gland. Addison's disease attacks the adrenal glands. We'll talk a little bit more detail about each of those. The first one, RA, rheumatoid arthritis. This is where the synovial membranes of joints are attacked. This leads to the destruction of bones and the cartilage of these various joints, which will lead to the weakening of the soft tissue that supports the joints. And this can eventually result in the joint collapse, the fusion of bones, the shortening of tendons, and also disfigurement, particularly in the hands and in the feet. Some common symptoms of RA: joint stiffness, symmetric joint damage, and fatigue. You also can have fever. You can also have some systemic symptoms like anemia, dry eye, osteoporosis, increased risk of heart attack, blood vessel inflammation, whether it be in the pericardium and the lungs. There are juvenile and there are adult forms of RA. Women will be 2 to 3 times more likely to develop RA than men. And the cause for RA seems to be the combination of genetics and some environmental factors. It could be a virus, it could be bacteria, it could be hormonal changes. Now, diagnosis typically will consist of medical history, physical exam, imaging, lab tests such as leukocyte counts or red blood cell sedimentation rates, and the presence of a rheumatoid factor. But there's no one definitive test for RA. Treatments for RA, these can involve certain drugs, anti-rheumatic drugs, injected gold, methotrexate, which is a drug often used to treat cancers, Plaquenil, which is a malaria drug. You can have biological response modifiers, BRM. These will suppress your immune system by decreasing the immune-enhancing chemicals. When you decrease the immune system, you are decreasing how aggressive the autoimmune attacks are on the joint. Other treatments include lifestyle changes, such as eating healthier, exercising more, reducing stress. In severe cases, assistance devices, or even surgery. The next one, SLE, systemic lupus erythematosus, is where your immune system attacks your body's connective tissue. Common symptoms: fatigue, anxiety, depression, stiffness, joint pain, atherosclerosis, and fever. Some common symptoms of SLE: heart problems, anemia, kidney disease, chest pains, hair loss, rashes, in particular butterfly-shaped rashes on the face. Now, the course of the disease could be chronic or could be relapsing, remitting pattern. The cause for SLE is unknown. Some possible triggers could be genetics or could be environmental. The diagnosis: it's difficult to properly diagnose SLE because the symptoms will vary from patient to patient, and there is no one clear definitive test for SLE. But they usually will include medical histories, tissue biopsies, imaging studies. Could include some lab tests such as blood counts, urinalysis, erythrocyte sedimentation rates, complement levels, Also checking for anti-nuclear antibodies. Could also include various drugs, NSAIDs, steroids, immunosuppressants, also BRM drugs. All right, now we'll talk about the activation of these lymphocytes. Now, lymphocytes develop and mature when you're young, and they will begin as undifferentiated cells with the potential to become anything. So during the maturation process, they will become very specialized and will develop a very special function. Now, undifferentiated lymphocytes are produced in the bone marrow, and then some will migrate to the thymus, and they will become T cells. That's why they're called T cells. The T stands for thymus. The other lymphocytes will develop and mature in the bone marrow, and they are called B cells, so B for bone. Now, these lymphocytes, once they're specialized, will wait in the lymph node until a pathogen they recognize. Now, these may remain in a suspended animation for a very long period of time. So once they are activated or woken up, which is called lymphocyte activation, causes them to circulate throughout the lymphatic system and are able to fight pathogen. Innate immune system phagocytizes infected cells. They will display a part of that pathogen on its surface, and this makes them visible to very specialized lymphocytes. This is needed to activate those lymphocytes, and it's the beginning of the adaptive immunity. These are called antigen-presenting cells. So this is what I mean when I say the innate system and the adaptive system must work hand in hand. If the innate system doesn't go through this process, it can't activate and trigger the adaptive immunity. So you must have pathogens being engulfed, destroyed, and then a piece of that stuck on the surface of the phagocytotic cell to present it for your adaptive immune system to be able to be activated. Here's a summary of the lymphocyte differentiation and activation. Of course, all blood cells will originate from the bone marrow. Some will go on to the thymus to mature. They're called T cells, or T lymphocytes. Others will stay in the bone marrow to mature, and they are the B cells, or B lymphocytes. Then once they mature, they go to a lymph node and basically hang out until they're activated, until they're needed. Right now we'll talk about a lymphocyte proliferation. You only have a few lymphocytes that can recognize each pathogen, but you need hundreds of thousands to attack an infection. So the reproduction of a lymphocyte is called lymphocyte proliferation. There are two types: proliferation of helper T cells and the proliferation of other types of lymphocytes. Now, the helper T cells are probably the most important cell in your immune system, because this will activate a large portion of your adaptive immune system. So there must be a large number of these helper T cells present before they can activate other lymphocytes. Helper T cells are stimulated to divide and then bind to antigen-presenting cells by stimulation of cytokines. These helper Ts will continue to divide and then help the proliferation of B cells and other types of T cells. So if these helper Ts are not present, then they can't activate other lymphocytes. They can't activate the B cells, and it's the B cells that actually will make antibodies. So certain diseases that affect the helper Ts, such as AIDS, for example, that's why that disease is so destructive. It's taking out the key component of your immune system, the helper Ts. Okay, and here's how that works. Here you have the antigen, here, this X-shaped structure here, being engulfed by its macrophage. After it's engulfed, it's broken apart and destroyed. It presents a small piece on its surface right there. So this is now an antigen-presenting cell. By doing this, this activates a helper T cell, which is here. This causes the macrophage to secrete interleukin-1, which is a special type of cytokine, which is going on right here. This interleukin-1 will stimulate the helper T to secrete interleukin-2, which is another cytokine. When that interleukin-2 binds with other receptors on its surface, this will help the helper T cell to divide, and divide fairly rapidly. And these cells that are produced are called daughter cells. Now, the daughter cell that's produced can divide again if it's exposed to the same antigen. So this greatly increases the number of helper T cells pretty rapidly. And as these helper Ts are being produced more and more, they can stimulate the B cells. And it's the B cells, which we'll talk about in a few minutes, that will actually secrete and produce the antibodies. But if this one piece isn't here, you don't get the lymphocyte activation, you don't get B cell activation, you don't get antibodies being produced. So this is the key player in your entire immune system here, the helper T cell. All right, now we'll talk about pathology connection, HIV and AIDS. AIDS, acquired immune deficiency syndrome. Now, AIDS is the disorder, the actual syndrome that's caused by HIV. HIV is a virus, the human immunodeficiency virus. So there are not two diseases. One is a virus that causes the disease AIDS. Now, AIDS is characterized by a very severely decreased immune function. And this happens because AIDS will destroy helper T cells. It also will destroy lymph nodes due to a chronic infection. So this will decrease the amount of immune-enhancing chemicals in the body. So you really don't technically die from AIDS, you die from complications caused by AIDS. Now, HIV can be contracted through sexual contact, sharing of IV needles with infected drug users, the use of blood products from mother to fetus in utero and in breast milk also, and also accidental exposure to an infected body fluid, which is not that common. Some symptoms: approximately 4 weeks after the HIV infection, the patients will develop flu-like symptoms because your body is attempting to fight off a virus. So it may present initially as just a bad cold or bad flu, and the immune system may continue to fight off the disease for the next 10 to 12 years without any obvious symptom. Now, eventually, the disease progresses to AIDS-related complex, or ARC, or full-blown AIDS. And some of these symptoms may include fatigue, enlarged lymph nodes, weight loss, night sweats, diarrhea, central nervous system dysfunction, some forms of cancer, and opportunistic infection. Now, those are present because your immune system is so compromised. Other infections that would normally not be that big a deal for you are now a very big deal because you literally have a suppressed immune system. Diagnosis: medical history, having a low helper T cell count, less than 200 cells per microliter. Treatment: patients with HIV will usually be given a combination of antiviral drugs that will help block viral reproduction, also will help the virus from assembling new viruses, or block the entrance of viruses into cells. Now, these drug regimens tend to be very complicated, taking a certain amount of drugs at very set amount of times. You can't just take drugs in the morning or at night. You have to take them at prescribed increments, like every 8 hours, every 12 hours, on the dot, every increment of time. This has to be measured very precisely. And these drug regimens often have very severe side effects, and they can lead to infections, and then these infections are treated appropriately. All right, now we'll talk about B cell action. We talked earlier about antigen presenting cells. Sometimes they're called antigen displaying cells, or ADCs. When you get this occurring, these cells will send out a certain signal that are calling for weapons of adaptive immunity, basically alerting your adaptive immune system. For B cells, these are a type of adaptive immunity, such as antibody-mediated immunity. You can fight pathogens by making and releasing antibodies that attack specific pathogens. And it's important to remember antibodies are just proteins. They aren't destructive cells. They can disable a pathogen, and they can mark it for death and make sure it gets killed, but antibodies themselves don't do the killing. They don't do the destruction. They make it possible for them to be killed. Now, B cells could develop into plasma cells and memory B cells. Now, the plasma cells are what make the antibodies that are secreted into the bloodstream. The primary response is where you have antibodies will bind to antigens of infecting cells and help to destroy the pathogen by inactivating the antigen, which is called neutralization, basically by blocking the active sites where the antigen can't bind to the cell, so it can't do its job. It can cause the antigens to clump together, which is called agglutination. The B cells can activate the complement cascade, and they can also release chemicals that help stimulate the immune system and enhance phagocytosis. Now, other B cells, like memory B cells, are stored in the lymph nodes until they're needed at a future date. These are basically the filing cabinet, the keepers of the database of all pathogens that your body has fought in the past. So when they are exposed to it again, the response can be much faster and much more aggressive. This is called the secondary response. So your response will get better with more exposure. And here's what I mean with the primary and secondary response. This blue line is the primary response to an antigen. As after initial exposure, you get the concentration of antibodies that peaks right about here. As the antigens are being destroyed, and of course they get less and less and less and less. But with a secondary response, there's going to be antibodies already ready to go because you've already fought that pathogen before. So the response will be much higher in concentration of antibodies. So much more aggressive, much faster response. All right, now we'll talk about the various types of T cells. There are 4 types of T cells. Helper Ts, which we've talked about a few minutes ago. Cytotoxic T cells, or killer T cells. Regulatory T cells, and memory T cells. The first one, the killer T cells, or cytotoxic T cells. Now, these play a key role in what's called the cell-mediated immunity response, because these cells directly are responsible for the death of pathogens, or pathogen-infected cells. And how they work is similar to the natural killer cells of the innate system. They release a cytokine called perforin, which basically pokes holes in a pathogen until it ruptures the cell membrane and it falls apart. But in the cell-mediated response, they are directly attacking the pathogen. Now this is different from how B cells protect your body with the secretion of antibodies. That's called the humoral response, because it is secreting antibodies, and antibodies help to disable the pathogens. So the B cells aren't directly involved with the destruction of the pathogen. They don't get their hands dirty like the killer T cells do. So for killer T cells, they directly kill the pathogen. So that's a cell-mediated response. B cells making antibodies, and they take care of the dirty work. That is a humoral response. Now these killer T cells can also release other cytokines that stimulate both the innate and the adaptive immunity, especially in attracting macrophages to the sites of infection and to dispose of the cellular debris. And the response of these killer T cells is the primary response of the cell-mediated immunity. Next one, regulatory T cells. There's something has to be there to turn off the response when the threat has already been eliminated, or the immune response would just keep going and going and going and be totally out of control and would eventually just attack your own body, your own healthy tissues. So that's what the regulatory T cells do. They are the on-off switch for the immune system. Once the fight is over, everything is reined back in, and the fight is called off. Memory T cells. These are similar to memory B cells. They keep records, or they keep the database on pathogens that they have fought in the past. So when they encounter that pathogen again in the future, the response can be very aggressive and very fast. Now we'll move on to the different types of immunity that we all have. Now, acquired immunity, we develop our acquired immunity in several different ways. The first kind, natural active immunity. This is acquired in normal daily life, normal exposure to a disease. Someone who sits next to you, they have a flu, they cough on you, and you get sick. That's being naturally exposed to a disease. It's naturally acquired active immunity. Artificially acquired active immunity. This is acquired during vaccinations. Babies can acquire naturally acquired passive immunity by receiving antibodies from their mother's breast milk, or even across the placenta. You can also have artificially acquired passive immunity, where you receive a direct injection of antibodies. Alright, here's a summary of all four of those. You have immunity that's naturally acquired and artificially acquired. And a good way to keep these two separate, anything that is artificially acquired, you are being injected with something. So injected with a vaccine or injected with antibodies. If something is active, you, the person, are developing your own antibodies. If it's passive, you are receiving already made antibodies. So for naturally acquired active, normal exposure to a disease. Naturally acquired passive, a newborn is receiving already made antibodies from its mother in breast milk. It's artificially acquired active. You're being injected with a vaccine. That's why it's artificial. But your body is developing its own antibodies. That's why it's an active form. The artificially acquired passive, you're being injected with antibodies. So that's why it's artificial, because you're getting an injection. And it's passive because you're getting pre-made antibodies. Alright, so here is the big picture when it comes to the immune system. There's an army of pathogens who want to get inside your body and make you sick. So in order to do that, it must get past the first line of defense, the first barriers. If the invader gets inside your body, there's a series of weapons that are stimulated because that pathogen is a foreign particle. It is not of your own body. A variety of cells, including neutrophils, macrophages, and basophils, become stimulated. Certain chemicals are released, cytokines, that will stimulate the inflammation and the phagocytosis. You have macrophages and other cells which have ingested some of this invader, will move toward the lymphatic system and will search for a lymph node, looking for a B or T lymphocyte that is able to recognize this bit of the intruder. The helper T cells will activate and cause a proliferation of B cells and killer T cells, as well as releasing chemicals to further stimulate phagocytosis and inflammation. You have killer T cells that are activated and proliferate in number. B cells are now producing antibodies that will help to disable and destroy invaders and to further stimulate an immune response. These killer T cells will destroy these invaders directly in the cell-mediated response, and also release chemicals that will increase the immune response. And the immune response, whether it be both innate and adaptive, will continue to be stimulated until this feedback loop is turned off. And that's done so by the regulatory T cells. Okay, so after this, you have memory B and T cells are stored in lymph nodes for later use if another invasion of the same pathogen were to happen again. Then macrophages and other phagocytic cells will clean up the garbage that's left over after this battle waged between the immune system and the invading army. And then the body will go back to normal. So here's the continuing with the military theme here. It's the battle plan for the body's defenses. Antigen here being engulfed by a macrophage. It destroys it, puts a little piece on its surface. It's now an antigen presenting cell or antigen displaying cell. That will stimulate the helper T cells, which will stimulate the killer Ts and also the B cells. The B cells will proliferate into plasma cells, which secrete antibodies, and also memory Bs. This whole side here of this chart, or of this image, is the humoral response, because you're involving antibodies being injected into the blood. So you're going into a body humor, and humor, another word, is another word for a fluid when it comes to anatomy. These killer T cells will proliferate into memory T cells, and also will further activate other killer T cells. And then these will go out and directly attack the antigen and kill it. Now we'll move on to a pathology connection. Hypersensitivity reactions. These are also known as allergies. This is where the immune system will mount a hyperactive response to a foreign antigen, and often treating harmless antigens like pollen or grass or mold or an insect bite as a more serious invading pathogen. Now, the hypersensitivity reactions such as hay fever, hives, skin rashes, asthma are generally mild and non-life-threatening. Now, the systemic hypersensitivity reactions, or anaphylaxis, are life-threatening and are very, very serious. It's where you have mast cells and basophils release immune-stimulating chemicals throughout the entire body, causing a widespread vasodilation. This causes a very severe drop in blood pressure. It can lead to heart failure. In addition to this reaction, you can also get respiratory distress and hives that accompany this anaphylactic reaction. Now, when it comes to these types of reactions, mast cells are found throughout the body. If they are overstimulated in the eyes, they'll cause red eyes or runny eyes. If they're overstimulated in the lungs, they cause allergic asthma. Other immune cells involved in these allergic reactions, basophils, B cells, eosinophils, macrophages. These will cause increased inflammation and the release of immune-stimulating chemicals, like histamines, for example. Now, most people who have one type of allergy also suffer from others. A person that has asthma may also have hay fever allergies. And for some patients, a mild allergy may progress to become a more severe form of that allergy. Okay? And when it comes to hypersensitivity reactions, there's something called a atopic march. This is where you have an early exposure to an allergen may cause something simple like a skin reaction, but later exposure will cause allergic rhinitis, and then later exposures cause asthma or even anaphylaxis. The more exposures you get, the more progressive and severe the response is. Now, diagnosing allergies can be difficult. Blood tests may show increased immune activity, but may not be able to pinpoint any particular allergen. A common way to test allergies is to expose a person's skin or a blood sample to a suspected allergen and see if there's a reaction, but these tests are often inconclusive. Treatments for hypersensitivity reactions. Of course, the best treatment is to avoid the allergen, but if a patient is allergic to something very common like pollen or grass or mold, it may not be realistic, may not be possible. So medications can be used if the allergen is unavoidable. Okay, what you have here is a mast cell that's covered with antibodies that will bind to a particular allergen, in this case pollen. So pollen from this plant will combine with the antibodies on the mast cell. This will cause a release of histamine. Alright, now we'll recap some common disorders of the immune system. The first one, lymphoma. Etiology here, An uncontrolled proliferation of lymphocytes. There are 30 different types. Signs and symptoms: enlarged lymph nodes, weight loss, fever, other generally vague symptoms. Some diagnostic tests: biopsies, imaging, bone marrow testing. Treatments can range from chemotherapy to radiation, antibody therapy, and even stem cell or bone marrow transplants. Tonsillitis, etiology: inflammation of the tonsils due to a bacterial or a viral infection. Signs and symptoms: sore throat, swollen tonsils, fever, swollen lymph glands, a visible coating or visible spots on the tonsils, and also upset stomach. Diagnostic test: an exam showing the inflamed tonsils, and need to be able to rule out bacterial infection. Treatments: if it's a bacterial infection, treat with antibiotics. If it's viral, rest in fluids until the virus will eventually run its course and go away. If the swollen tonsils are impairing the breathing, then tonsillectomy may be necessary. Leukemia, etiology: is excess production of white blood cells, which causes a decreased function in white blood cells and red blood cells and platelets. Signs and symptoms: increased infections, anemia, bleeding, bruising, fatigue, weight loss. Diagnostic test: complete blood count, genetic testing, bone marrow biopsies. The treatment can depend on the type. It could be using stem cells, it could be chemotherapy, it could be bone marrow transplants. Hodgkin's disease, etiology: is the cancer of the lymph nodes affecting white blood cells. This is a type of lymphoma, and most common in people between the ages of 5 and 35. Some signs and symptoms: a painless swelling of lymph nodes is an early symptom, often in the neck. Fever, night sweats, weight loss, weakness, fatigue, itching. Respiratory symptoms may occur with some chest involvement. Diagnostic tests: biopsies, various types of x-rays, ultrasounds, lymphangiograms. Treatments: possibly chemotherapy, possibly radiation, depending on the age and the stage of the cancer. Rheumatoid arthritis, etiology: due to the destruction joints by the immune system. Some signs and symptoms: swollen, painful joints, anemia, cardiovascular abnormalities. Some diagnostic tests: blood tests, imaging studies. Some treatments: lifestyle changes, BRMs, DMRDs, and this is often difficult to treat effectively. Lupus, etiology: is the destruction of many different body tissues by the immune system. Some signs and symptoms: swollen, painful joints, fatigue, anemia, cardiovascular abnormalities. Some diagnostic tests: blood tests, imaging studies. Treatments: just like with rheumatoid arthritis, DMARDs, BRMs, lifestyle changes, but another one that's very difficult to treat effectively because it involves so many body systems. HIV and AIDS, etiology: is an infection of the helper T cells by the HIV virus, which causes a decreased number of T cells, which will eventually lead to a very severely deficient immune system. Signs and symptoms: flu-like symptoms in the very early stages, and then opportunistic infections and some forms of cancer when you get to the full-blown AIDS stage. Diagnostic test: medical history, having a very low helper T cell count. The AIDS diagnosis is made when your T cell counts become less than 200 microliters, or less than 200 per microliter. Treatments: a series of complex drug cocktails that are designed to prevent infection from progressing to the full-blown AIDS stage, and the treatment of opportunistic infections as they develop. SCID, severe combined immune deficiency. The etiology: caused by a severe decreased T cell production, and sometimes other cells, caused by a number of genetic defects. Signs and symptoms: repeated opportunistic or severe infections in babies, and this can be fatal if left untreated. Some diagnostic tests: genetic tests is the best way to identify this. The treatment, depending on the underlying genetic problem, could be anything from enzyme replacements to a complete sterile environment for the person, bone marrow transplants, stem cells, gene therapy, and most types of this condition are very difficult to treat. Allergies, etiology here is an overreaction of your immune system, typically to very harmless antigens, pollen, ragweed, cat dander, mold, and so on. Signs and symptoms will depend on the severity. Could be upper respiratory symptoms, asthma, watery eyes, skin rashes, and in severe cases, anaphylaxis. Diagnostic tests, medical history, the elimination of the suspected culprit, skin test, and blood tests. For some treatments, probably the best one is avoidance of the allergen if possible, antihistamines, allergy shots, steroids, and epinephrine. All right, we'll end this chapter with our pharmacology corner. Anti-inflammatory drugs, like the name implies, they will decrease inflammation. And a common type of this are the NSAIDs, non-steroidal anti-inflammatory drugs, NSAIDs. Some examples of NSAIDs: aspirins, ibuprofen. These act to relieve pain and inflammation by inhibiting hormones called prostaglandins. Now, some common side effects of these types of drugs are the formation of stomach ulcers. Steroids, common examples: cortisone, prednisone. These are administered systemically, either by injection or by an oral dose. These can also have some dangerous side effects if taken for too long a period of time. Topical steroids, the ones that are applied to the skin or to the nasal passages, these are effective for treating skin inflammation and upper respiratory symptoms due to allergies. Inhaled steroids are often used to control asthma symptoms. And the topical and inhaled steroids typically do not have the severe side effects that go along with the oral or injected steroids. So these tend to be a much better option. Some drugs for allergies, antihistamines. These will decrease the activation of mast cells. These will tend to work well, but can often cause severe drowsiness. Cytokine blockers, blockers of antibodies that will mediate allergies, and also topical steroids, such as inhaled medication or nasal sprays. Now, patients with anaphylactic reactions to common allergens may be required and should be required to carry an EpiPen for emergencies. All an EpiPen is a shot of epinephrine that's contained in a stylus that looks like a pen. That's where you get the name EpiPen. And this shot of adrenaline will constrict the blood vessels, will stimulate the heart, will open up air passages, and will decrease the effects of the anaphylactic reactions, and giving the patient more time to get proper medical care. See, drugs for autoimmune disorders, DMARDs, disease-modifying anti-rheumatic drugs. Some examples of these include immunosuppressants, such as cyclosporin, which is an anti-rejection drug used for people who've received organ transplants. Injections of gold, methotrexate, which is a chemotherapy drug used to treat cancers, and also some anti-malarial medications. Now, how these drugs exactly work is not terribly understood, and these can become very highly toxic. All right, next kind, BRMs, the biological response modifiers. These are given to patients where the DMARDs haven't worked in the past. And these work by suppressing the immune system, by decreasing the immune-enhancing chemicals, or by inhibiting proliferation of cells. Some examples of this, drugs that would inhibit the TNF, the tumor necrosis factor, which is a cytokine. Humira is a trademark name. Remicade is another trademark name drug. Enbrel, Rituxan will inhibit B cells. These are all trademark brand names of these types of BRMs. Some side effects of these may include an increased risk of infection, and may also include an increased risk of some forms of cancer. So there are some side effects to these BRMs, but overall they tend to be less toxic than DMARDs, and often will do a better job at decreasing fatigue in patients that have rheumatoid arthritis. Alright, that brings us to the end of chapter number 14. We will continue our anatomy series in our next video covering chapter number 15.